A blazing afternoon it is. Welcome to the webinar on Gender and COVID-19 by the Women Empowerment Cell of Kongonadu Arts and Science College. The Women Empowerment Cell strives high with, according to our tagline, She is the origin, she is the destiny. The activities primarily focuses on the upliftment and boosting women and girl children. The extended wings of the club, Abhaya Dakshina, a group of girls volunteers who educate kids on child abuse, and Alleviators, a student mental wellness group formed by the cell to help out each other. The activities like webinars worked in the past serve the motto of the club to instill power and positivity in women. Now, I request Dr. P. Divya Priya, Associate Professor of Commerce PG and Commerce with PA, to welcome the participants.
Good evening, everyone. On behalf of Women Empowerment Cell and Kongonadu Arts and Science College, Coimbatore, I take it as a pleasure to welcome you all for the webinar on gender and COVID-19. I am happy to welcome our President, Dr. M. Aruchami sir, who has always been the pillar of strength and motivation for all of us. I welcome you, sir. I am delightful to welcome our Secretary and Director, Dr. C.A. Voski ma'am, who has always been a source of encouragement to all of us at all times. I welcome you, ma'am. I extend my warm welcome to our principal, Dr. M. Lakshmanasamy sir, Chief Executive Officer, Dr. V. Chinnasamy sir, Dean Academics, Dr. S. Madan Shankar sir, to this webinar. I welcome you all. I welcome all the participants who are virtually connected with us for today's program on gender and COVID-19. I welcome you all. I'm extremely happy to welcome and introduce our chief guest, Dr. Sundari Anita. Sundari Anita ma'am is reader at the School of Social and Political Science, University of Lincoln. She has researched and written on forced marriage, marriage migrants' experience of domestic violence, transnational abandonment of women, dowry related violence, sex selective abortion, gender based violence in university communities, and South Asian women's industrial militancy in the UK. She previously managed a women's aid refuge and worked for ASHA Projects, a specialist refuge for South Asian survivors of domestic violence, and has been active in campaigns and policy making to combat violence against women and girls since 1999. She is on the editorial board of Violence Against Women and Women's Studies International Forum and a member of the Academic Forum of Runnymede Trust. She has also reviewed many articles and books. She has written expert reports for court cases on issues relating to domestic violence and dowry. She has also acted as consultant to IMCAN, a second-tier organization providing support, advocacy, and training to Black and minority ethnic refuge, Saheli, a specialist refuge, and IMI's Turkish speaking women's group. As a consultant for West Women Ministers Foundation for Democracy, she has contributed to the draft of the Arab Convention on Combating Violence Against Women. I now request Dr. Sundari Anita ma'am to address the participant in the room. Thank you.
Thank you, Divya and Dr. Sumati for inviting me to talk to you. And thank you, all of you. It's quite a good attendance, 129 people here, for giving your time to come and attend this meeting. Before we start, can I just a couple of things to make this meeting manageable? Can everyone please turn your audio off and camera off? Just because of the size, it's much easier to manage. And can you please use the chat facility to make comments as I speak, because I can see it and then I can respond to your comments if appropriate while I'm talking, or make a note of it for later. And again, can you please let me know through the chat facility if you can hear me talking now, if my voice and the camera is okay? Yep, okay. So one yes, so I'm assuming you can hear me. Um, Dr. Sumati, can you please tell me how much time I have? And then it'd be nice if we have time for questions as well at the end, so I can plan what to say in terms of arrange it according to the time. Could you put it in the chat? Okay, I'll wait for that. Um, while I get that information, I wanted to tell you a little bit about my area of research. And Divya did introduce me, but just want to focus on the topic itself. So my two areas of research are violence against women and girls and gender and work. And those are the two areas, 30 to 40 minutes. Thank you, Dr. Sumati. So those are the two areas that I want to focus on today. But before I start, I have a special connection with Coimbatore. I was born in Secunderabad, and I spent the first couple of years of my life in Coimbatore. I have visited there since, but it's been a long time since I last went there, and I have family, like cousins, who still live there. And so, yeah. So when I heard, when I saw the invite was from there, I thought I couldn't say no to this. And the topic as well, but as a special connection with Coimbatore for me. So today I want to talk about COVID-19 in relation to these two areas of my research, violence against women and girls and work. And that's how I shall organize my talk. What we know about this pandemic and what we know about crisis more broadly, not just this pandemic or health-related crisis, but also war, civil war, famines. So any of these events exacerbate existing inequalities. And that's exactly what COVID-19 has also done. So while it creates new difficulties, these difficulties in the context of war, civil war, famines, pandemics, don't affect everyone equally. Those who are disadvantaged are disproportionately affected by any of these changes. And that's exactly what we're seeing with COVID-19. So the first area I want to focus on is domestic violence. And in terms of COVID-19, the health effects of COVID-19 itself are gendered in that men are more likely to experience more severe symptoms, and men are more likely to enter critical care. And we know from different countries, though this trend isn't mirrored in India, and that, you know, we need to think about why India is bucking the trend here, or seems to be, though we don't have data. The trends from different countries show that men are more likely, once they enter critical care, to have lower survival rates. The reasons are still being explored, but it's what the evidence that's emerging or consensus that's emerging is that a lot of this is due to other factors, behavioral factors. Men are far more likely to smoke, far more likely to consume alcohol. There is also wide research that on hand washing and personal hygiene, compliance rates are lower among men. Men are more likely to abhor the use of masks, and men are more likely to violate social distancing norms. So there could be a connection, but some of it could also be biological. The immune response to the body is different, but that's not my area of expertise. It's a difference among men and women. What I'm interested in is the social consequences of this pandemic, and particularly the social consequences of how we respond to this pandemic through lockdowns. So in the UK, and I'll refer to UK because that's my area of research, but also draw parallels to what's happening in India. In UK, I work closely with domestic violence organizations. I'm a trustee of a refuge or shelters, as they called in the US and other places, are safe spaces where women and children can go to when they want to flee domestic violence. They're funded by the state. So I've worked closely with shelters and domestic violence organizations, and I even managed one. I was a service provider 20 years back for a long time, for more than 2 decades. And what we are seeing in the UK is an increase in domestic violence in the context of lockdown, which is true in all the other contexts, countries where lockdown has been imposed. What's happening is that there's an assumption. Lockdown assumes that movement of people is what transmits disease, which is true. And therefore, the way to keep society safe is to restrict people within their home. But the central paradox is that the home is not a safe space for women. and for children. And therefore, when policies like lockdowns are imposed without thought to what's happening, then this space of home becomes increasingly dangerous for women and children. And we're seeing that. So during lockdown, there's been an increase in domestic violence, increase in the UK context, in contacts to services. There has also been a huge increase in domestic homicides when domestic violence results in the murder of women by their partner. And we've seen a huge increase in that. So the prevalent rates have gone up. And the reason for that is domestic violence is essentially about control. It's about coercion. It's about controlling the life of this other person. In a context where this form of control is deemed acceptable by society. So a similar form of control, a similar form of physical violence against other members of the family or community would be unacceptable, deemed unacceptable by society. And it's seen, people turn a blind eye to that. Neighbors hear, but don't do anything about it. So that's the context in which this control operates. And usually, when domestic violence is often not a new outcome of lockdown, these are already abusive relationships, but the functioning of normal society minimizes or at least manages the opportunities for abuse or violence. So the husband may be going out, so the contact, his access to home is limited in that he's out for work, or she may be going out to work. So the time at home is limited. There are other people she can contact for help. So all of that is how domestic violence is ongoing, but it's deemed manageable. Now, what lockdown has done is it's locked the woman in a house with her abusive partner, locked the children in that house where schools are not functioning. So in a context of child abuse, school offers a safe space. So there it's a relative space of safety where they can be away from the perpetrator, where they can recover, where they can potentially contact sources of support like teachers. And those safe spaces are removed when you're stuck in the home with the abuser. And that's the context in which abuse is increasing, and the prevalence rates increasing. What we're also seeing is that the forms of abuse are also changing. And in the UK context, what we're seeing is there are specific COVID-19 related forms of abuse. So, for example, men, if they're infected, are deliberately infecting their partners. So the thinking is, if I've become ill, how come you're okay? And so they're coughing on the women's faces, they're deliberately trying to infect them. Or in some contexts where there's high risk activity, like if there's going out, it's women who are allocated that job. So men are shielding themselves. And so there are specific forms in ways in which domestic violence, the nature of domestic violence is shifting to accommodate these new forms of harm. And domestic violence is about harm, and perpetrators are opportunistic in terms of the forms of harm shift to accommodate our changing world. And we see that in the context of broader harms, for example, street sexual harassment, what is wrongly called eve teasing. I have a problem with that term. So those public forms of harm against women have shifted to online. So you have online forms of abuse. So harms and these gendered harms shift to accommodate the technology or changes that are happening in the world. And they've similarly shifted to accommodate COVID-19 related specific harms. What's also happening in the context of COVID-19 is the services have changed. Services are no longer able to operate face-to-face, and they are online services are increasing in compared to face-to-face services. And that also has an implication. So on one hand, it's increased the contact to services through online contacts has increased, but we also need to be very mindful that not everyone has access to these technologies. Not everyone's able to use those services. And in the context of domestic violence, we have I have interviewed women over years who talk about how their phone usage is monitored, how they are allowed to use the phone, but they're not allowed to have internet access on their phone, so they can't contact outside agencies. So those are contexts in which it becomes very difficult for women who are experiencing an increased level of domestic violence and new forms of domestic violence may find it even harder to access formal services. But in the context of India, that access to formal services is a very small part of how you might respond to domestic violence. There is, in my recent research in India, which took place in North India, so it was in Gujarat, Delhi, and Punjab. What I've found, and this is nothing new, you all know it instinctively or from living in your societies, for women experiencing domestic violence in India, contacting formal sources of support is not the first option. It's not, and leaving the abusive relationship is often not seen as an option because of economic insecurity. So often the first option, or possibly the only option many women see themselves as having, is informal sources of support. So their parents' home. And what I found in my research is when the violence was deemed unbearable, most women went to their parents' house for a brief period of respite. They reached out to formal and informal sources of support, like neighborhood groups, to try and minimize the violence, to try and persuade the man to minimize the violence. So these were the ways in which women responded to this violence, to try and make it manageable. And those forms of support are also disappearing because of social isolation. You're not able to reach out. Women aren't able to move to their parents' house, which might be in another city, might involve long travel. And so there are several ways in which both the extent of domestic violence, the nature of domestic violence, and how you might respond to domestic violence has shifted under the pandemic. That's the first thing. The second aspect I want to explore is gender and work, where again I want to draw on my experiences of researching in this area. What we've also seen during this pandemic and lockdown is a real impact on women's both domestic work and paid work. So in the UK context, what we've seen is that women are often facing the brunt of risk of exposure to COVID-19 because of the jobs they do. So these jobs are in the hospitality industry, in the service sector, so caring, in the health services or elderly care. They're also working in retail. And so a lot of these jobs and the gender distribution of labor in these jobs is something we've lived with for a long time, where certain jobs are deemed as women's jobs. What's happening now is historically these jobs have been underpaid. They're considered low status jobs. So caring for others, caring for children, caring for elderly, nurses and healthcare workers who are not doctors, but even cleaners in hospitals. These are low status jobs comparatively, and nurse is a high status job, but it's low paid in the UK context compared to, say, working in the banking sector. And so these jobs were seen as women's jobs, and therefore they attract, and they're seen as natural to women. Caring is seen as natural to women, so it's seen as unskilled, and they attract low wages. At this time, what we're seeing is suddenly a reconfiguration of what's essential to society. For a long time, we've been told that people get paid according to what society values. And therefore, these jobs are not skilled, they don't require any special attributes, and therefore we pay them less. Feminist economists have argued that it's not anything inherent in the job itself that means we pay it less. It's because these jobs are considered women's jobs, we pay them less. The other argument has been that these jobs are not central to society. These aren't, anyone could do that. What we're finding under COVID-19 is suddenly, when we look at the list of essential jobs, we find that all of these jobs which are lowest paid are now considered essential jobs. So makes me wonder, no one's arguing for hedge fund managers or people who work in the city to be considered essential workers. So it's quite interesting how suddenly all of these jobs have become essential. They're women's jobs, low paid, but they're high-risk jobs because these are jobs where the workers are exposed to COVID-19 without adequate personal protective equipment, and therefore they're bearing the risk of looking after all of us and pulling us through the lockdown with very little advantage. What's happening within the home as well is that the gender division of household labor is increasing during COVID-19. As children are staying at home, they're not in school anymore. Women find that their caring responsibilities have increased. Women are also finding that when you look at gendered division of household labor in the UK and in India, what research has found is that as men and women are more and more learning to work from home, so and this only applies to say middle class jobs where you can do it online. Men have increased the amount of time they spend on housework, but women who are also in work and working from home have increased the time far more than men. So we're finding this disproportionality in household work has increased even more during COVID-19. And for an example of academics, so my profession, so I'm a professor at a university. It's a relatively privileged occupation, secure, well paid. Even in my occupation, what we're finding is submissions to journals have increased since lockdown. Men's submission to journals, submission of journal articles have increased. Women academics' submission of journal articles have decreased during lockdown. So even in a privileged occupation like mine, we're seeing a gendered effect of a reduction in productivity by women. And this has an outcome. It has a long-term outcome for our promotions, and it has a long-term outcome for whose job is valued more. And so in many ways, we're seeing these shifts, these divisions exacerbated under the pandemic. I think looking at the time, I've got about 10 more minutes, so I have just a couple of more points. The last thing I want to look at is the role of the state in all of this. You might say what's happening, domestic violence is happening within the domestic sphere, within home, child abuse, domestic violence, and in terms of women's role in the labor market, you might say that's the economy. The role of the state is crucial to all of this. So if you think about how lockdowns have been imposed, they've been imposed in a very gender blind way in the UK as well as in India. So in India, for example, when a list of essential services were first compiled, sanitary pads were, the production of sanitary pads weren't part of that. So clearly, people who are making these decisions have no understanding of women's needs if they couldn't even think that this was an essential service. In the UK, we've had a scheme where those who are self-employed and they have tax returns. So if you're self-employed, you compile your income and you send it off. And so based on your tax, the income that you've declared for your tax purposes, you could claim 80% and then 70%. So for the first 3 months of the lockdown, you could claim 80% of support from the state. So this was a scheme that was for self-employed people. However, there was no recognition of if during the last 3 years when you returned your tax, when you did your tax returns, whether you had a child during that period. Because if you're working in a government job, for example, or if I work in the university and I have a maternity leave, I get maternity pay during that period. If you're self-employed, for 1 year, your tax return in the last 3 years may be low because you've had a child and taken time off work. So in this whole provision, there was no consideration of whether you were on maternity leave during those last 3 years, in which case they should discount the fallen income for those nine months or 12 months, whatever the average maternity leave is. So they could draw upon national statistics and do that. So it just shows how a lot of decision making in response to COVID-19 and lockdown is so gender blind, and how we need to rethink how we respond to this pandemic so it doesn't exacerbate existing inequalities based on gender. So I'm going to stop here, and perhaps if you could post your questions on the chat, I can respond to that. Thank you for listening. Shivkumar Krishnamuri, you said you wanted to ask a question. Maybe if you can post it, if you're still here. Or Dr. Sumati?
Yes, I'm here.
Ma'am, Dr. Shivakumar Krishnamurthy posted a question, ma'am.
Okay.
Actually, he wants to ask.
Okay. Oh, I haven't scrolled down. Let's have a look. How did China control what areas? And what will be the new normal in academic post-COVID? Okay. if I could predict the future, I would do very well indeed. There's a huge difference in terms of thinking about how how different countries have controlled COVID-19. Now, that's not my area of expertise. What we have found is countries where there's a high compliance with mask wearing, for example, where there's countries which have had previous experience of pandemics, and therefore their test and trace system was already effective. They had tried it out and they rolled it out very quickly. Those countries have been far more effective. What we've also found is populist countries which are held by populist governments, anti-expert, which have been more skeptical of health expertise, have on the whole tackled this pandemic with less positive outcomes than others. So UK has done very badly. It has one of the highest per capita death rates. US has done badly. Brazil has done badly. With India, we don't know. It's still in early stages in India, so it's very hard to see the outcomes at this stage. So we have found that countries, but it's early to work out what is effective and what's not. Also, comparisons are very hard because these countries are very different. So Singapore and other countries which have been effective, not only do they have previous history, culturally they're very different countries, and their systems of governance are very different. So I wouldn't go there because it's not my area of expertise, and it's probably too early to make a call on that. But in terms of the new normal in academic post-COVID world, I think we're going to move increasingly to more online teaching in the short term. But for me, there's also a worry that in the UK context, a lot of our university lecturers are on temporary contracts, so insecurity for them is going to increase. I worry for other academics who are at high-risk groups, because our own university's got blended learning, a plan for blended learning, face-to-face as well as online teaching. But I worry for my colleagues who are in vulnerable categories, whether they will have the freedom to opt for online learning. To what extent will they have this freedom? So, but it also represents some opportunities like this one. So a webinar probably wouldn't have been normal, and it presents opportunities for us to reach across the world to have these conversations. We could do that earlier, but somehow it wasn't a cultural norm. So I'm hoping this one part of the lockdown and the effects of the pandemic will stay with us, because this is a positive effect where we can have more dialogues and discussions across continents. I'm not sure if that answers your question, but let's have a look at, I've got one more question. Mad Clown has a question. A woman in Gaya, Bihar was assaulted by a doctor in the COVID-19 isolation ward. What do you think? Where do we think we failed in protecting women? Now, this is one instance. So these forms of harm are taking place everywhere, whether they are in the isolation wards by doctors, or whether they're in the home where it's children and women being abused by the patriarch of the house. So yeah, it's something that's happening across the board in terms of different forms of violence. So in isolation ward, for example, I would be very mindful of thinking about having women nurses, access to women medics there, because it's potentially it's sealed off from other places, so then it poses particular risks for women. I think of having women-only wards, definitely. So gender segregated wards. So in the UK, we don't have that, and because a lot of these wards are very bustling places, so there isn't a need, isn't perceived to be a need, but isolation is a very different situation. One more question. Many families have prepared for themselves for abortion during this pandemic. Huge attack on abortion services, reproductive services is happening across the board. In India, in US, we've seen several states use the cover of COVID-19 to cut down or to dismantle existing provisions for reproductive rights. And so we need to be very mindful about how the lack of consultation and emergency provisions during COVID-19 can be used to curtail human rights, to curtail freedom of speech, dissent, and women's reproductive rights. And what we know is often these rights, once lost, are much harder to regain. So that's something we really need to be alert to. In UK as well, we need to be thinking about what the move to online reproductive healthcare means. So, for example, in the UK, after childbirth, the health visitor from the National Health Service, so it's a free service, comes to the home of the where the child's been born and has discussions about weighs the baby every week, has discussions about in the first 2 or 3 weeks to support the mother and child. And often from my research, what I've seen is disclosures of domestic violence happen to that health visitor or to the midwife during pregnancy. And we know from research that pregnancy is a time when domestic violence increases. In the Indian context, domestic violence often increases during pregnancy or just after birth, more in the context where it's a girl child who's born. So when services, reproductive services shift online, those opportunities for disclosures, which have worked effectively in the past or more effectively than other opportunities, are being closed. So there's a whole range of issues, implications for reproductive health that we need to be very mindful of. Domestic violence has increased. So Kumaresan, however, in many families, the role and significance of women has been realized by spouse. So I think what you're referring to is that women's value is recognized. See, I'm very skeptical of this argument that that women are seen as devis. We recognize women. All that is very well, but what we need is not just recognition. We also need redistribution. So it's all well to say, I recognize you are very important to my existence, but to act on that recognition is to say, I will recognize your importance by sharing power with you, by sharing my economic gains with you. So it's all very well to say that because we have to do our own housework, we recognize how important domestic servants are to the running of middle-class households. But for me, that recognition has no meaning unless it results in having decent wages for domestic servants, for having paid leave, paid maternity provisions for domestic servants. Otherwise, without representation, what does this recognition itself mean without actual material gains? So, I'm not convinced that recognizing significance itself means something. So there is an increase in domestic work by men during this period, but this increase is very small compared to the increase in women's domestic work. So men have started taking part in domestic work more than they used to because they're at home. But even in households where both of them are working full-time, the increase that women have put in now is far more than the increase that men have put in. So the gap has still become wider. How has the role of working women become multifold, become a mother, teacher, maid during COVID-19, still not given importance? In some ways, it hasn't changed. Women have always done all of that. Women have always had second shift. And those who work full-time in the UK and in the Western world as well as in India. So this is not something that's unique to India. Even in households where men and women work full-time, women have still done the disproportionate amount of housework. And this is something I have examined in the course of my research. So what we see is in households where, this is something a recent research, which is across seven countries in the so-called Western world, global North, where it compared the amount of housework done by men and women, where both of them were in full-time work. And it disaggregated it by if the woman earns more than men, does it shift? If the woman works longer hours than men, does it shift? What happens when one of the couple loses their jobs? So the last one was very interesting for me because this was in the context of recession, and now that's happening in the pandemic. And what research found was that when women lost their job, paid work, they increased the amount of housework they did quite significantly to compensate for the loss of paid work. When men were the one who lost paid work during the recession since 2008, and women were the one who was the only paid worker in that household, men increased their domestic work to some extent because they didn't have any paid work, but women in those families who were now the only earners increased their domestic work by even more than the men. And I was completely surprised at that. But there is an explanation. When men lose their paid work, they also lose their status in our society, their gendered status as breadwinners. And therefore, the women were increasing their work, household work, domestic work, even more than their unemployed husbands to reaffirm the men's status as the man of the house. And so it's very complicated how these things work. It's not just about whether you have time to do the housework, it's about cultural norms, about whose job it is to do housework. So let's have a look at Azil. Thank you for sharing your research. It was all in front of us, but missed few facts which you shared. Might have just had to see a bit more about what's happening. Okay, so what I might do is I might send a list of readings perhaps to Dr. Sumati, which you can share later. Deepika Menon, agree with you, but the lockdown has made many men understand how much of work a woman is doing at home. Yeah, so I think it's visible. So I'm hoping it will result in shared housework. So just visibility and knowledge of this is what women are doing doesn't necessarily shift the balance of power. So let's see what happens. I'm skeptical. The Veena SP, the theories of feminism and women's rights evolve and differ from one country to other. What do you think is the crux of gender bias that shouldn't be given up in spite of cultural and geographical difference, ma'am? So I don't quite understand what this question is. So perhaps, Veena, could you post a comment on what exactly you mean so I can answer it appropriately? So Kalpana Devi, I know what your perception towards women protection in India. By citing different cultures, what difference would you like to see in our country regarding women and her rights? Oh, that's such a big question. What would I like to see? I'd like to see so many changes. So in my just two areas of work, violence against women, I'd like to see more recognition of the root causes of domestic violence, which is gender inequalities. And that is asking for a very big change. And I doubt I'm going to see such a massive shift in my own lifetime. Maybe things will change for my children. And in terms of the world of work as well, there is so much I'd like to see shift. I'd like to see the state take more recognition of women's caring roles because the economy couldn't survive, couldn't sustain itself without the free labor that women provide. So, for example, in the UK, we have state pension, and historically, the state pension was only available based on your contribution to paid work. And the assumption was men go to work and women do housework. So in their old age, women were in poverty, especially if they separated from their partner, because their unpaid work was not recognized in the pension provision that men got because they were engaged in paid work. And so if you're thinking of private work, for example, so again, pension, you get pension because you're in work, but the only reason you're able to save to work and to get that pension is because someone's doing your housework. And so as far as, so we still don't have adequate division of pension, for example, upon divorce, because the only way men could get pension in their old age is because there's someone at home looking after the children. I personally work in another city. So I live in London and I work in Lincoln. So for 3 days a week, I go to Lincoln and I stay there at night. The only reason I can do that is because my husband's looking after our children in London. So without his contribution to the childcare, I couldn't do my paid work. And so as far as I'm concerned, my paid work is only possible because of both our labors of childcare as well as work in the university. So that shift is something that needs to happen to protect women. How to overcome depression about future family necessity. I think anger is a good way to overcome depression. Anger is a very useful sentiment, which is not recognized. It's because it's only when you're angry that you act and to change the world. So I think anger is a really useful way to proceed because it mobilizes action. It's based on a basic dissatisfaction with the way the world is. Okay. I'm just going through the question. If changes happen in feminism, what type of changes? I think in the context of India, as well as in the context of the West or global North, feminism needs to be more inclusive. So in the context of India, for example, feminism needs to represent the needs of and voices of all women. And by that, I mean voices of, and if anything, the voices of those who are marginalized needs to be at the forefront of feminist movements. And by that, I mean voices of women of subordinate castes, voices of women of religious minorities, indigenous, so tribal women. And that's when I would consider feminism to be a truly global movement. In the context of the West, feminism needs to take account of Black and minority ethnic women's needs because those are the voices that are often missing from this debate. Okay, I'm still going through the questions. On education, there's a question about girl child's education. On that, what we know is when we look at other pandemics, so Kamali Siva has raised this question. When we look at other pandemics, so when we looked at Ebola, for example, what we found was after that period of disruption by the pandemic, women's enrollment in schools, girls' enrollment in schools dropped. What we also found was that child marriage increased. And we also found that particular forms of forced marriage, female genital mutilation, so particular forms of violence against girls increased as a consequence of pandemic. So in India, I'm worried that this closure of schools might mean that when things go back to normal, when schools open, enrollment rates of girls might fall. So that's something to be very alert to. I think, what is your view on pseudo-feminism? False feminists who promote dark sides of feminism. I'm not quite sure what pseudo-feminism means. False feminists who promote dark sides of feminism. I'm not quite sure what you mean by that. And so I will give that a pass. So I think we've been here, had about 20 minutes of question. Dr. Sumati, do you want to carry on, or I see lots of
So any other questions? I think madam answered for all the questions in the inbox. Any other questions you can ask students, professors? You can also shoot your questions.
Yeah, so maybe it's yeah, go on. So we've got I'll say in my time it's 11:22, so maybe 8 more minutes till 11:30 we can carry on. So if you have anything more, I'm happy to chat. Or you can go, because I'm sure you have lots of important things to do. Thank you for your positive feedback. I see a few on the side. So I'm assuming there are no more questions.
Yes, ma'am. Yes, ma'am. We shall wind up. Thank you so much, ma'am. We shall have a sort of.
Okay, can I just ask you one question? Can I answer one question? So, yeah. So Matt Clown has said, feminism is not. I'm getting some echo. Can you? Yeah, mute. Okay, thank you. So feminism is not outrighting men. I'm not quite sure what outrighting means, but protecting women. I think not all feminists understand that sense. What do you think about them? Okay, so I think one thing that we really need to be clear about, and I've thought a lot about this in the context of the anti-racist struggle in the UK and in the global North. There's a sense of unease and discomfort among white people when we want to talk about racism because they sense that their privilege is being questioned At the moment, it's not being dismantled. We are very far from that. We live in a racist world, and in the UK, I see that all around me. I never even thought of myself as racialized until I came to the UK and suddenly realized I was this brown person who was had a subordinate status in society, who had this weight of history upon me. And so there's a sense of discomfort among white people because they feel their privilege is being questioned, they feel threatened, and behind that, I think, is this reluctance to give up power. Yeah, and I think there's a parallel between that and debates on feminism. So when we talk about equality or rights for women, we are asking for those rights and equality in a context where women have a subordinate status, where women may be valued as devis and held on a pedestal for the fact that they give birth to children or they do housework, but that never results in equal division of inheritance rights or equal allocation of resources at the household, spending money, equal pay for work of equal value. So that holding up on the pedestal doesn't mean anything to me if it doesn't result in shared resources. And part of that fear is this reluctance to give up power. And in many ways, I have very little patience with people who are scared of that because no change can truly happen if you hold on to your power. And that's unfair advantage and unfair power that you're holding on to. So racial justice cannot happen without those who hold power now in the world, white privilege, to be dismantled. So unfortunately, we cannot have racial justice with those who are privileged holding on to their power and some form of justice, because justice requires dismantling that power. So some people who now hold power, undue power, will have to give up that power for there to be equality. And the same applies to feminism. For there to be equal rights, those who hold privilege and power at the moment will have to give up some of that privilege and power. So some of it will not be so. So at the household level, it means that if both men and women do housework, I grew up in a household where both my mom and dad went to work in two different branches or two different government banks. They went to work at the same time, came back to work from work at the same time. My dad went and read his newspaper. My mom went to the kitchen. So clearly she was doing a second shift, he wasn't. And so till if for there to be equality in my house, my father would have had to give up power. So instead of when they came back from work, instead of my mom spending 5 hours in the kitchen and my dad's having 5 hours of leisure, he would have had to spend 2.5 hours in the kitchen so she could spend less time. So I think feminism requires that men give up power. Those who hold power requires. And if they're scared of that, it means they're not willing to give up power. And so we need to question that. We need to challenge that. And maybe the reason why change is so difficult on race, for example, on caste, is that those with power don't want to give up. Why would they? And so sometimes, the only way is to rise up and to challenge it and to require. So there has to be a day of reckoning. Why would you give up power if you didn't have to? So I think I will end on that note, if that's okay, Dr. Sumati.
Ma'am. Yes, ma'am. It was really a wonderful session, ma'am.
Thank you. Maybe it has some feedback. If Dr. Sumati can compile some feedback and maybe something. So I'll say bye now. I'll just type a thing. Thank you for being here.
Dr. Chitra, I request Dr. Chitra to come up with a vote of thanks. Dr. Chitra?
Yes, ma'am. All reserved appreciation goes to the Almighty for making today a memorable day for us. Good evening to all. I consider it is a great privilege to propose the vote of thanks on this special occasion. First and foremost, I would like to thank our management, Honorable President Dr. M. Aruchami sir, beloved Secretary and Director Dr. C. A. Vasuki ma'am, Principal Dr. M. Lakshmanaswamy sir, CEO Dr. V. Chinnuswamy sir, Dean R&D Dr. Paul Sami sir, Dean Academics Dr. Madan Shankar sir, IKAC Coordinator Dr. P. Sujata ma'am, who always stand by us, guide us, lead us and motivate us. Thank you all. Next, I extend my warm gratitude to our chief guest, Dr. Sundari Anita, Professor, University of Lincoln, UK, for all the words of wisdom which radiated energy within us. We will ever remain grateful to you and we thank you for being with us as a chief guest today. Madam, here I want to highlight one quote. The best and beautiful things in the world cannot be seen or even touched. They must be felt by heart. We feel proud and thank you for making us feel happy with your presentation. Thank you, ma'am. I wish to express my sincere gratitude to all the members of staff, students, Women Empowerment Cell members for their unflinching support and coordination. My heartfelt thanks to all the participants for active participation and also my special thanks to participate from other countries. With these warm words and kind message, we move to the end of today's session. Once again, I thank you all for your kind attention and making this webinar a grand success. Have a great day. Thank you.